the Ministries of Health are expected to have upwards policy dialogue, working with the Parliament, with the government, intersectorially, because health very often depends on other sectors and how they act. But also going to the local level, reaching out to people in the villages, in towns, at their homes, that they can make healthy choices, so ensuring the environment where people live is more healthy, but also convincing other sectors to make those choices easier. As well, there are more development partners now in health that we saw 10, 20, 30 years ago. So Ministries of Health are expected to coordinate with them. And it is not anymore only the public sector. You need to manage the public sector, but also agree the rules of the game for the private sector. And then the constant dialogue with people and civil society organizations. So if we compare the governance as we thought about that 20, 30 years ago, today it is much more complex. It is more demanding within health sector, where we want to achieve universal health coverage, but also there are demands beyond the health sector, going intersectorially to achieve the sustainable development goals by 2030. It is not easy to describe what the governance is. For me, it is a number of keywords. So it is about the leadership. It is about getting everybody to think more about health, but it's also about the management, how we manage that the whole sector works together and that our performance is good and we engage with other sectors. But it is also about the data and transparency. Are we sharing the information about the health status, about the issues? Are we monitoring where we are going? And also it is about the institutions, how the whole health sector infrastructure works, that we move towards universal health coverage, that we can ensure that there is access to services, especially for vulnerable. They are protected. It means that they don't become poor when they use the services, but also that the quality services and medicines and vaccines are available for them. So the whole structure needs to work in a way that everybody who needs the service can use the service and doesn't become poor because of that. I think we are better equipped than before, but we need to study the topic. We need also to share the information, but we need to listen from practitioners, because governance is a theoretical subject, but what we need to have is also practical experiences, how things are done. Because very often when I talk to the ministers and we talk about what needs to be done, most of people know that we need to increase the vaccination coverage, we need to engage on tobacco control, we need to work on maternal and child health, or we want to have access to quality medicines and services. The question is how to do it. And there, the governance is one of the key words that we need to address and to go to the details of it and start to work further to improve the population health. What is the experience in the past years? And I can go back to Kyrgyzstan, where I'm now the WHO representative. We can bring 3 examples. What we try to do in practice to improve the governance of health system. First, vision for health. It means that we support the Ministry of Health and stakeholders to develop the new health sector strategy for 2030 agenda. It means that within the health sector, there is a vision how to improve public health, improve the financing of the health system, improve service delivery, that it is human-centered and really takes care from youth to elderly. So it means also life course approach. And also the information technology is there and innovation is there. But also going beyond health sector and addressing that intersectorial element. So having upwards policy dialogue. So first, vision for health and having health strategy, which both sets the vision, but also tools for implementation. Second, working on institutions. In past few years, we have worked with a health insurance fund in Kyrgyzstan to help them to develop their institutional strategy, that they have their internal goals. So all of their 300 plus workers know where they want to go, what is the vision for the insurance fund, that they can ensure that insurance fund works in a way that it purchases the services for vulnerable and those who need access to services, and also ensures financial protection. That everybody shares that vision, from those who work in all 7 oblasts to those who work in Bishkek in the center. And the third example, I would say, is coordination constantly with the development partners, who are all optimistic and enthusiastic, supporting the sector development in Kyrgyzstan. But also we need to ensure that our actions are complementary. We cover all the area of the country, and we actually walk the same walk in the same direction. So practical examples are really to set the vision for health, work with institutions, and partnership that we can really move forward. So these are few practical examples of governance work that the WHO does in Kyrgyzstan.